Gauteng, over 20,000 patients have been harmed in the province's hospitals due to the incompetence of staff members, negligence, and human error. At Rahima Musa Hospital, 9 infants died after a bacterial outbreak. And now at Telle Mogoerane Hospital, 2 babies have died after contracting a bacterial infection, and staff are calling for CEO Nomonde Mkhayimbambo to be fired. Are our healthcare services in this province deteriorating? And what is the health department doing to deal with these bacterial outbreaks? Joining me to speak to these issues is Gauteng's Health MEC, Dr. Gwen Ramakgopa. Good evening, Doc. Thanks very much for your time. Well, you've been in this job for what? Just over 18 months now.
Yes.
And you are appointed on the back of a very tragic episode in the life of our country, the Life Esidimeni tragedy. Do you think that over the past 18 months you've restored the public's confidence in the state healthcare services in this province?
For your first, thanks for having me here. And I just want to first start by saying that it is correct to characterize the health system in Gauteng as being under a lot of pressure because of high demand. And this demand comes from the burden of disease, the high urbanization rate. Just to share with you, in around 1998, the population was about 7.5 million. And currently it's about 14 million. And indeed, whilst there's been new hospitals, new clinics, but the expansion was not at the rate of the demand. But there's also a burden of foreigners. So all these demands are competing for few resources in terms of the number of beds, number of the staff-patient ratio, and all that. But the public health system...
that can be the complaint that you put forward all the time. I'm not saying just you, but your colleagues who have come before you, but your colleagues in other departments. The 2 things you're talking about, which is people coming from wherever they are coming from in the country, descending on Gauteng. Because you ought to be, in constant touch, communication with your national counterpart. You have those min-max, but also within cabinet. There should be conversations about what that does to health services. The same can be said about the burden of foreigners that you are talking about. We know for a fact that there are people from other countries who come here who are obviously going to put a strain. So that excuse shouldn't be holding in 2018. Well,
unfortunately, that's the reality that the health system is facing. But despite all that, the health system in Gauteng is an asset, is a national asset, because by far the majority of our people depend on these facilities. And these facilities have got the highest number of specialists. It's actually the largest health system in South Africa, if not in the continent. And it's a training platform for both public and private sector specialists. So yes, we've got a number of centers of excellences, but yes, there may be areas where there's a need to put more attention, especially where there is a shortage of staff. And I'm really glad that this year, we were able to fill about 2,000 posts right at the beginning of the year. And with the stimulus package that the President has announced, there's also a recognition, what you've indicated, that we must communicate with national. There's also a recognition that there is a need to have more staff. But in addition, the NICD, which is the National Institute for Communicable Diseases, does surveillance all the time, because hospitals, in hospitals, there may be hospital-acquired infections. Different patients come with different illnesses. And when patients don't respond to a particular treatment, we send blood to the laboratory to diagnose. So from time to time, the NICD does release reports to say that, like for instance, at Telle Mogoerane, the babies that were affected could not respond to the ordinary medication. And therefore, we had to, from the NICD results, we then applied for the higher level medication that these bugs can respond to. So it is...
which you got?
Yes. Pardon?
Which you got?
Yes, which you got, and quite a number of babies did survive because of that. What I'm saying is that one baby lost is one baby too many.
So,
but it could have been worse because of the support of NICD, the quick diagnosis, the availability of stronger medication. We could be able to cut the outbreak.
So the situation is challenging, to use some of your words, but you're not bankrupt, number one.
Not at all. This year is
and
much
you are getting assistance from people like the NICD with regard to the outbreak, for example. But can you say that you, as the political principal and the person who must ultimately take responsibility, you have done the best that you can do within your powers and with the resources that you have?
Indeed. In terms of that, yes, we are doing the best we can, and I think our heroes and heroines are the men and women at the front line of services, the nurses, the doctors, the porters, who are caring for our patients every day. What we have done, we have made sure that we've stabilized the finances this year. If you remember, in the previous years, the issue of the very high number of deaths that we inherit. So we have stabilized, we have a payment schedule for our service providers. And we have also made sure that we protect the clinics and the hospitals from this debt. So we are paying it from head office so that the budget of this year is available to support services in the front line.
I want to go through some of these issues and incidences, like case by case.
Yes.
But before we do that, I want us to take a call. There is Laurie on the line, and Laurie is from Fourways. Laurie, your question, comment?
Hi, it's actually more of a comment. I think let's cut to the chase. All the money in the world is not going to help when basic things like cleanliness are neglected. Our hospitals are filthy, absolutely filthy. You walk into hospital. I had the misfortune of walking into the Joburg Gen a few weeks ago. There was vomit on the passages floors. There was blood. There were old dressings. There was hair. I mean, if that is what the corridors are looking like where the general public is walking through, I'd hate to see what the wards are looking like. I find that so many people are saying we went for a massive op, or so-and-so went for a massive op, but they survived the op, but they picked up a super bug. What is the super bug? The super bug equals uncleanliness. Bottom line.
Let me see.
The issue of cleanliness is an area all over the world that is focused on. The national norms and standards also focuses on that, and we regularly monitor the hospitals and the clinics for cleanliness. There are those areas that we are concerned about, and we continuously give feedback to management. But there are also those areas that we are proud of. Like there are a number of clinics that have achieved platinum status, and those are benchmarks. And even when the public comes, the public says, this is the best clinic. Why doesn't my clinic become like this? So we encourage members of the public to indeed raise these areas when they find that they are not compliant, but we are also monitoring continuously.
Like Laurie was doing on cleanliness. Let's get Anonymous now, who is from Pretoria. Anonymous, your question, comment?
Hi, speaking to Anonymous from Pretoria. I just want to make a comment, actually, regarding the current statistics that he's actually putting through in terms of people being employed. Particularly, I'm a clinical psychologist, just to put things in context, because I've been unemployed for the past 3 months, and there hasn't been posts for clinical psychologists. And as you know, mental health is a very important issue in South Africa, but there isn't posts. So maybe if you can just clarify that for us.
Let me see.
What is her qualification, by the way?
She's a clinical psychologist.
A clinical psychologist. Okay.
But there are no posts.
I think it's Nomonde. Nomonde can actually contact us, and then we can look at where the posts are available. And I think that is one issue that is of critical priority, the issue of mental health services. But I think she must contact me, and we will look at where these posts are available. As I've said, we advertised about 2,000 posts for this year, and it includes also psychology, clinical psychology posts.
MEC, in the interest of time, I just want quick responses to these very specific situations or instances. Let's talk about the Mogoerane Hospital, CO Nomonde Mkai Mbambo. What's the situation there? What are you doing about that situation?
The unions did raise concerns about her management style, her management effectiveness, and very serious allegations. And we take these allegations seriously, and the head of department has put her on special leave whilst this investigation. And I have no doubt that there will be swift action to ensure that we resolve this matter as soon as possible. But amongst other things, it is the allegation that she did not prioritize the filling of certain posts. We will have to look at whether the problem is at the institution level or at the head office. But whoever has to answer will answer.
But that may well be about whether she prioritized this or not. But, I mean, you have the health minister, Dr. Motsoaledi, saying that overcrowding was responsible for Klebsiella at that hospital.
Well, overcrowding is throughout the health system. And in addition to
but surely, I mean, something like that shouldn't stand in the way of I mean, you should be able to find creative ways. I mean, you can't say a baby cannot die simply because the hospital is overcrowded.
No, that is why I'm saying, Vuyo, we will have to look at whether she took reasonable steps to mitigate the issue of overcrowding and also of appointment of staff. What I mean specifically here is that of the 2,000 posts that we made available, we said that hospitals and districts must prioritize maternal and neonatal health services, psychiatry, casualty, and also theater, because those were the areas of pressure that we know. So that's what we are trying to ascertain. Did she take reasonable steps?
But can you say, for example, taking this, let's say this is the case of Nomonde Mkai Mbambo. Yes. Let's take your case. Let's take the Bank of Lisbon building, where employees spoke about this over and over again. There were inspections. The place was found to be only, 21% compliant. But nothing was done about that.
I must say that when I got to that facility, we used to be stuck all the time in the lifts. And I met the workers personally. So
you two are familiar with
Yes, I'm familiar with that. And there was a program.
You never put pressure on anyone to do something about it.
If you can ask the previous acting HOD, if there's one area that we were really at loggerheads on, is around the quality of our building, because the workers raised it with me.
3 firemen still died. And they were not supposed to have been there.
Yes, that's really regrettable. But let's leave that to investigation as to how was it possible that they died. But we want to say that we honor them and that we know that they should not have died. But we want to get to the bottom of under what circumstances did they die. But I can assure you that there are quite a number of projects that were underway as I speak. I mean, before the fire, the lifts were functioning well. There were projects on electrification repairs. There were programs on plumbing, and there were programs also on air conditioning. So there was something that was happening, and indeed we found...
What is the problem? The fact that we get satisfied with the little things that seem to go well, when in fact everything should be going the way it's supposed to.
That's what we're working towards. We're working towards the health system working well. There are areas of excellence, as I've indicated. There are areas where we are concerned, very gravely concerned that we are intervening. And there are also areas that we know that we should be intolerant. I deal also with, for instance, appeals. We've had a number of dismissals, amongst others, for lack of diligence at work, and also for just incompetence as well. So we must intervene.
Let me say thank you very much. I hope you